everyone, welcome to the Hormone Lifestyle Zone. I'm your host, Meg Riccici, and this podcast series is about demystifying women's hormonal issues and struggles and all the things that dance in between. So, as you all know, I try to bring a deeper awareness and understanding to different aspects of women's health. And one that I've really been wanting to explore for a while on the Hormone Lifestyle Zone is dealing with pelvic floor dysfunction. Pelvic floor issues impact women on so many levels. On a physical, on an emotional, it can take toll on a woman's energy, her marriage, self-esteem, overall sense of self. And over the years, I've referred clients through to physical therapists that specialize in pelvic health and pelvic floor issues. And, it's interesting, as when I started out as an acupuncturist 28 years ago, at that time, there were not a lot of PTs that specialized in pelvic floor therapy. And it was really exciting to find like these little tribes of women in New York City that were doing it, these amazing physical therapists. So I'm really delighted to have created such a connection with these women over the years. And I've always referred out to PTs specialized in this area when I was in New York City, when I was in Charleston, and I'm very excited to my next guest is one of the top in Atlanta. I'm going to tell you more about her in a few moments. But PT issues, pelvic floor issues have been an issue that I have looked at when I was an acupuncturist. And working with these physical therapists that specialize in this area is absolutely profound, because 1 in 3 women will experience pelvic floor dysfunction in her lifetime. And pelvic floor dysfunction refers to a broad constellation of symptoms. Symptoms that include pain during sex after having babies, mysterious sciatic pain, frequent need to urinate, chronic UTIs, or the sensation of having a UTI without the presence of a bacterial infection, urinary incontinence, fecal incontinence, and constipation. Constipation is a big issue that I see in my practice, and it's one of the reasons why I wanted to explore pelvic floor issues today, because as many as 50% of people with chronic constipation have some sort of pelvic floor dysfunction. And I am so delighted that I was able to reach out to Merci Ortenzi Treaster. She is an exquisite pelvic health physical therapist, and she has a PhD in physical therapy. She's an expert in the area of pelvic floor dysfunction and is the owner of the Pelvis Pro right here in Atlanta. She has one of the leading pelvic health physical therapy groups. And before I bring Merci on the show, I just want to say to people, and before she and I take this deep dive, that I just want to touch base with everyone. And I want to thank so many of the sweet lovelies that listen to this show and have sent me emails asking me to further explore various issues that has been coming up frequently over the years. Is, what I see with women is chronic UTI infections and being on antibiotics prophylactically every time, or recommended by their doctor, every time a woman has sex to prevent a UTI. And then these women get these hellacious vaginal yeast infections and start getting digestive gas and bloat issues. So I've seen this a lot. Or I'll see a lot of hormonal imbalances with women, and they have terrible IBS. Because frequently people will call me and they'll say, Meg, I have a hormonal imbalance. I don't know what to do. And 99% of these women are experiencing a lot of IBS and a lot of digestive issues. So I always say, if we want to address the hormones, we have to take a look at the gut. But I also look at anxiety. I see a lot of women reaching out. They have PCOS and they're tired of dealing with birth control and metformin. And they want to find other options. And it's because of you I'm committed to addressing these topics on the Hormone Lifestyle Zone and also in my practice. So I just want to let people know that you can also, if you are listening to this and you are new to the podcast, you can subscribe on iTunes and Spotify. Share these episodes with the women in your lives. It makes such a difference. And you can also watch the Hormone Lifestyle Zone on my YouTube channel at the Hormone Lifestyle Zone, Meg Richichi, and I'll link that information because that is a new addition to the podcast. And if you'd like to work directly with me, you can. I've just created a great program called the Hormone or the Gut Hormone Reset to help so many women explore these issues, to resolve issues related to the gut and the hormones. And I always say to women, if you want to reset your hormones, you've got to reset your gut because they both go hand in hand. So again, I want to thank everyone for joining me today on the Hormone Lifestyle Zone. If you would like to work with me, you can find all my contact information at megrichichi.com, and would love to explore the possibility of helping you resolve your hormonal issues and demystify a lot of the health challenges that you face. So right now, I am delighted to invite Merci onto the Hormone Lifestyle Zone. And my love, thank you for being here today.
Yeah, thanks for having me. I'm excited.
So, it's funny. I really loved when you had on part of your bio. I just think it's so interesting that you said when you what I love about your story is that one of your moms is an OBGYN, your other mom is a chiropractor, and you've said out popped me a pelvic health physical therapist. It was almost in your DNA to find yourself somewhere in the world of women's health. And I would love for you to, share your story. How did you get into this incredible niche in physical therapy?
So I think that describes it perfectly with Outpop, the pelvic health PT, because I was kind of raised in this world of medical and holistic, just coming from two very different sides of Eastern and Western medicine.
Mm-hmm.
And many nights I was with my OBGYN mom in the delivery room. Gosh, on the weekends, I would go to the nursery. I was just around women and babies so much in between, nannies that we had and things like that for care. So I kind of watched my mom as a business owner as well, help women her entire life. She just retired after 41 years of women's health.
Wow.
And then my other mom, who's a chiropractor, still practicing. And I think I wanted to do something similar, but maybe not something that required 80 plus hours a week of my
Yeah.
time. And then the other thing is in the car, so many times my OBGYN mom would say, let's call Ro, my chiropractor mom, and discuss things based on what that woman was saying about hip pain or back pain. So I kind of was like, there's got to be something that's mixing the women's health, vaginal, rectal health, and then with the pelvic floor along with the musculoskeletal system. But when I was in college, kind of like you were saying a while ago about not many pelvic health PTs, that's what I found. I mean, I was just searching for someone just to talk to. And the
Mm-hmm.
majority of people I found in the research was in Europe, Australia, Canada, not the United States. But as I made it through my college years and then started physical therapy school, more and more we're starting to grow practices in Atlanta. So I shadowed with a few, and I just knew right away that was the bridge between an OBGYN and how does a woman actually symptomatically get better if medically they're okay, which is I think where a typical gynecologist would come in that prenatal postpartum stage. And so I just love it. I right out of PT school went straight into pelvic, which is all extra training afterwards.
Yeah.
So I didn't do a lot of pelvic PTs, did ortho for a while, and then kind of went into the pelvic. I went straight in. So I've been practicing since 2016. And then I had my son in 2018.
Wow.
And that is when I decided to start my own practice. I kind of wanted to be a mom and a pelvic PT. And so I said, well, I'm just going to do my own thing. So I did that. So he was a huge piece of that. I had not a fun delivery. I had to be induced. I had an episiotomy because of a quick induction, fourth degree tear. So I had a
Oof.
lot of fecal issues, urinary issues, prolapse, pelvic pain. And as a pelvic PT, I knew how to approach those, but like any provider, can't do it to myself. So I saw a colleague of mine for 2 years after I gave birth to
Wow.
him. And that is when I kind of pigeonholed my practice more into women's health. Before that, I was seeing men, but I just decided that women is kind of where I saw my practice
Well,
going.
I say that you cultivated a niche, my love,
Yes.
as opposed to pigeonhole. I think it's, I think that's extraordinary. And also for you to go through that journey. And are you still having any issues? Have you resolved everything?
Everything is pretty much resolved. I'm sure we're going to talk about prolapse later, but
Yes. Yeah.
I still, I tell my patients this and I tell myself this, once a
Hmm.
prolapse, always a prolapse. So you can
Hmm.
fix a prolapse without surgery. So I
Hmm.
do still have a uterine prolapse, a rectocele, which is a prolapse of the rectum into the vagina, and then a cystocele, which is a bladder prolapse. However, they don't affect my life. So symptomatically, I'm okay, but I still have the physical structures that have come down with the result from my delivery.
I was just going to say, so all of this resulted from a
Mhm.
delivery.
Mhm.
Wow.
Unfortunately, so when I had to be induced, I was 0 centimeters, and within 4 hours had my son, and he had some heart rate decel issues. And when that happens, my midwifery group made the decision of we either get baby out now via vacuum or we go into a C-section. And I had both my parents in the room. I had my partner in the room.
Uh,
And I think we kind of all made the decision together that we would use the vacuum, and typically vacuums result in an episiotomy.
okay.
And then the pressure from the vacuum obviously would have the organs that are in the pelvic floor, decel as well.
Wow.
All's good though, and I now have a better understanding. So I
I was
help.
just going to say,
Yeah.
sometimes I think a lot of us have various things that we experience that allow us to have that, aside from developing empathy, but really just wanting the knowledge to really understand how to address that in other women. Wow. Thank you for sharing that. That's, well, I've read your reviews are awesome. Women really love your empathy and how you really try to figure out what these women need to bring about recovery. So, I reached out to you a few weeks ago because I've noticed that I'm seeing, constipation. It's a big issue for me in my practice because if women are constipated, they can't detox. And if women have constipation issues, they're going to get a recirculation of the estrogens because they're not able to eliminate them through the bowels. And I treat a lot of parasitic activity and a variety of things. But I'm just seeing a wave lately of women with constipation, like a bell went off in my head. And pretty good in this area. I've been doing it for a while. There's something else going on. And I feel that part of it, and I started asking these women, are you having any pelvic pain? Are you having tightness in the hips? Are you noticing anything? So would love, I know there are many things we can talk about, but I'm hoping that we can touch base on the constipation issue because I have to say, I think for what I'm noticing, and you would know more, is there a weakness? Are people guarding? Are they restricting? Are they unaware that they're not able to release and let go? But I feel that's part of the picture, that there's some pelvic floor dysfunction. There's something else going on that's contributing to this issue.
For sure.
So,
I mean, I
yeah.
definitely agree. And each person is different. So we don't
Hmm.
always know if it's more of a upregulated pelvic floor or a more hypertonic or high tone pelvic floor or a more downregulated, weak, more relaxed pelvic floor, because it could truly be either until someone's evaluated, and we evaluate that with a vaginal or rectal exam or both to
Hmm.
assess for muscle restrictions. There's 11 pelvic floor muscles, which so many people think it's just a muscle, one muscle. They
Right.
are 11, and some are more posterior or on the backside. Some are more anterior. So depending on the restrictions of the fascia, the muscle, hip mobility, abdominal wall mobility. I mean, the muscles of the abdominal wall play a huge role in the pelvic
Hmm.
floor and in simulating your bowels. And even adductor, so inner thigh
Hmm.
muscle length plays a
Wow.
huge role. And so what we find with constipation a lot of times is it goes to a pressure issue as well as a high tone, typically pelvic floor issue. And then getting blood flow to that region with myofascial release in the pelvic floor muscles rectally and vaginally, getting just tissue to expand, and then teaching them how to properly breathe, pressure management with posture and lifting, pushing, pulling, things like that, and then proper bowel movement techniques. I mean, so many people are sitting on very high toilets trying to have a bowel movement, and they're bearing down or they're putting a lot of pressure in their chest and not letting air go into their belly, and they're pushing, similar to pushing a baby out. That's how they're pushing to have a bowel movement, which both could be done more efficiently. And then just teaching that proper technique can help as well.
This is great to know. This is important because it's such an issue. I think with women, more women have this than I think they realize. And I see a lot of women using, oh my gosh, taking fiber, and I've done a lot of stool testing, and I'm looking at a variety of things, and I'm like, there's a holding on of sorts
Mhm.
that's going on in that area. My sister-in-law, and she had a hip replacement, and she's had knee replacement, and she started getting all these UTIs, and started working with a really good, in where she lives, a really good, pelvic floor therapist. She said it changed everything for her. So,
A lot of times it's just introducing the person to their pelvic floor. A lot of
mhm,
people don't know that they're holding tension there. If you're holding tension in your shoulders, we can typically see it. It restricts
right.
motion. If you're holding tension in your jaw, it's typically restricting other issues. But in the pelvic floor, if no one kind of teaches you what baseline is, then people don't realize that they could be constantly clenching or holding pattern. We call it an upregulated pelvic floor, and that's multifactorial. That tends to do with how we hold ourselves. So cross-legged posture tends to create a lot of tension in the pelvic floor. And as women, a lot of times we are crossing our legs. Especially, I was raised in the South. You were kind of cross your legs, stuck in your
Hmm.
belly, and that causes a lot of tension there. Also, I think that the tucked posture that happens when you're pregnant and then postpartum, where your pelvis actually kind of goes into a posterior pelvic tilt, creates a lot of that tension as well. So a lot of times, in just a session or two, we're teaching women just how to, where is your pelvic floor? What is it supposed to be like? And then they have this aha moment of, oh my gosh, we always hear this. They come back the next session, they're like, you're right. I am constantly in a Kegel. I'm constantly clenched. And then when they can learn how to going down, regulating into the pelvic floor, and breathe into it, and then changing their posture and things like that, they're so much better. And that's the
Well,
majority of people we see is an upregulation.
yeah. And I, we discussed this when I first had a conversation with you. Um, a lot of women that I see with, TMJ stuff, they have issues with their pelvis. And I learned this in acupuncture from my teacher, Kiko Matsumoto. She's like, oh, you're dealing with TMJ. You've got to look at the pelvis. You've got to look at opening look at the sacral joint and open things up. And it made such a difference. But have you noticed that as you work with women and you release the pelvic floor, you create stability, that they start developing a different calmness in their bodies?
Oh, 100%.
Because that's
Yeah, because, well, first of all, diaphragmatic breathing, is usually an answer for so many problems. So once they start doing diaphragmatic breathing properly, getting that full 360 breath, then, they're controlling anxiety better as well. Less muscle tension here because a lot of breathing is accessory motion of the traps and the scalenes. And so overall, they're doing better in multiple ways, not just in their pelvic health or whatever they were coming to see us for.
Yeah. I mean, I've found over the years too, pelvic floor, pelvic area, first chakra, survival. That's the area that we tighten up. We're very protective. We're very guarded of that area. I used to remember, I stopped doing, I'm thinking about this, getting back into it again. I've kind of put acupuncture on hold through the past couple of years and really, just doing so much focusing more with other things in women's health and nutrition. And I'm going to be working on a book, and there's just a variety of things. But there are just times I'm like, ooh, if I could have this woman in front of me and just kind of open up the channels to help release the abdomen and the pelvic area. Because sometimes what I've even seen, just putting my hand over the navel, you'll see the belly quiver. And you've seen that too. And and people don't realize we're guarding. And I feel in an ideal world, every woman would so benefit from doing some pelvic floor work, like exercises, or, I would love for you to talk about that. I think that could really support women in having healthier cycles, in opening up blood flow that would enhance fertility. There are so many things. So can you kind of talk on that topic?
100%. I think 25% our patient caseload in my practice are women who are just coming in that preconception phase. Everyone always puts pelvic PT with the prenatal and postpartum, but
Right.
truly, a fourth of our practice is before that stage. And a lot of it is for, like you already pointed out, urinary frequency, urgency, that UTI feeling, pressure, pelvic pain, pain with intercourse, pain with sexual activity. And so we were just at a team building yesterday at a place in Krog Street, and the people who were working saw our t-shirts and were asking us about it. And they were like, well, we wouldn't do that until you have a baby. And I said, well, you wouldn't run a marathon without training for a
I
marathon.
love that you said that. I use that analogy with people.
But
You're
I think
right.
that it's so important that if you know baseline, then I could have a more efficient birth or the prenatal stage too. We have so much research, a strong core going into getting pregnant, a relaxed pelvic floor going into pregnancy can just have so many better outcomes. Maybe postpartum, so many women wouldn't have low back pain, hip pain, urinary leakage, fecal leakage, all the things if they had more knowledge up front, which is why so many PTs actually, some of the huge names in the United States have actually created some questionnaires to start maybe in the high school age, especially female athletes, because female athletes are a huge percentage of pelvic floor dysfunction, especially gymnasts, horseback
I was
riders.
just going to say that the gymnasts over the years that I've worked with, I've seen a lot of pelvic floor issues, really bad.
So if they have a questionnaire that maybe they're filling out, then they could see someone sooner than later. The problem is the insurance companies don't see pelvic PT differently than physical therapy. So pelvic PT, unlike other physical therapy, we can only see one patient at a time because it's in a closed setting. The patient is undressed. We're doing internal exams.
Yes.
In regular physical therapy, I'm bouncing from one person to another person, another. So because of that, most pelvic PTs in small practices are out of network. So it's just not as easy to kind of get to one in that sense. But that's going to continue to change once insurance companies see the importance and maybe how it could decrease them spending more money on pelvic surgeries in the future.
Or maybe less C-sections.
Yep. 100%.
Or complications during pregnancy, or delivery. This is, I I'm so glad to have this conversation because I think any woman that is listening today and is in thinking of getting pregnant or is pregnant, but if they're thinking about or planning another child or maybe their first one, I think the first person they should see is someone like you to prepare them for a better pregnancy.
And that's becoming more common. A lot of the midwifery
Mhm.
practices here in Atlanta are telling women, um, primary care physicians are, if they're seeing that recurrent UTI symptom, but it's actually not bacterial, they're referring out. So it's becoming more common. And as of 2018, we did develop direct access so women can come see us without a referral.
Mhm.
So once they hear about it from a friend or neighbor or family member, they're coming in. And that's why there's so many pelvic PT practices in Atlanta, which is a great sign.
That's great to know. I mean, I think the issue that's been difficult with me because I work with women around the country and they're like, I have been taking a antibiotic every time I have sex with my husband or my partner. I'm like, and 5 years. I'm like, this is not an answer to, and no one suggested seeing someone like you.
Mm.
So I think the more we educate primaries and other doctors that this is a really, really important area to address because so many women have chronic UTIs and they're
Oh,
young. And
yes.
I mean, I can address it. I'm really good if they're chronic and bacterial, and I do a variety of things, but I do believe that energetically, there's so many reasons. Microbiome, energetically, things are getting congested. In Chinese medicine, we call the lower burner, the lower jiao, the first chakra. How do we how do we open that? How do we relax that area? How do we enhance blood flow? How do we increase a healthy, vaginal microbiome? And how do we, and I do a lot of herbs to address this, but I think pelvic floor work is so profound because, and I feel you would agree with this, and I look at the pelvic area. This is an area that, each month a woman has the potential to give birth to something in her life. It's not just about the birth of a child. What do you want to bring forth in the world? How do you want to allow that to organically happen in your world? And I always talk about this in reference to one's menstrual cycle. So what do you want to create? To create, we have to make sure that the energetically things are open and can just unfold and be released into the world. And this area holds a lot of energy.
For sure. No, I 100% agree.
I love it. So, can you share some stories of clients that you've worked with or things that you were like, oh my gosh, some interesting pelvic floor issues that somebody may not have thought, wow, I'm having some pelvic floor dysfunction. I never would have known this.
Gosh, I would say that's every single patient, but I would say some things
Yeah.
that people would not really think of are post-surgical. So we have patients
Hmm.
all the time who I had a hemorrhoid removed, something as little as just getting a
Mm.
hemorrhoid tied off. But that discomfort from that and the scar tissue from that can expand, and then the pelvic floor can go into this protective state. So
Wow.
I've had a patient go from a hemorrhoid removal surgery, everything normal before that, no pain with sex, no urinary
Hmm.
issues, no fecal issues. And then within a week of having that, all of a sudden peeing every 30 minutes,
Oh,
having
wow.
fecal leakage, and then dyspareunia, which is pain with intercourse. And that all came from that moment, which is like a traumatic event. So other
Yeah.
traumatic events. Another post-surgical, we had a patient who had ulcerative colitis, who had abdominal and bowel surgery for that, and ended up having to cath because she was cath for the surgery. For some reason, could not release herself to urinate. So she was cathing at age 29 years old to pee twice a day,
Whoa.
and was basically thought her life was over. She was like, well, I guess I am just going to cath the rest of my life. And a lot of that was just retraining the pelvic floor to relax fully, to engage fully, and to know what was happening. So
To
that's a,
engage this too, right?
yep, yep. So that was huge. Gosh, we post surgical.
Did, so I have a question.
Mhm.
Did she have like an aha moment, like, oh my God, I mean, that's a big deal.
She did. And it definitely took time. But I think more of these
Yeah.
women are saying, why didn't anyone tell me? Because, like,
Yes.
both women who I just told you about, unfortunately, post surgical, they didn't see us until probably 6 months. We're talking half a year. So if they were
Hmm.
told sooner, then maybe it wouldn't got to that degree. We have right now a student at SCAD who is probably 19, 20 years old, and she has spasms where her whole body kind of jolts. And everyone's basically told her that, it was something more neurological, and she went down that route with her family. And she also, beyond that, had pain with sex, urination frequency, and things like that. So when we saw her, we were like, well, maybe some of this is just because everything in your whole body, we worked everywhere
Oof.
from here down.
Right.
And then the spasms decreased. So she was about to go down a huge rabbit hole that could have also cost, a lot of money. So that was very unique.
But you just said something, and I loved what you just said. You look at the whole person.
Hmm. Hmm.
So if they're having abdominal issues, you're going to look everywhere,
Hmm.
that because the fascia influences everything. I
Yep.
would love for you to talk about that, because that is so important. Because a lot of times in physical therapy, somebody's going to have a shoulder issue and everybody's concentrating on the shoulder.
I
Well,
know.
the hip could be part of the issue.
Definitely. Well, fascia is the only thing that's fully attached from the top of our
Mhm.
head to the bottom of our feet. So we are always checking everything because, like you just said, a lot of times a shoulder's not a shoulder. A shoulder's coming from higher or lower in the system.
Yeah.
The same thing with the pelvic floor. We may, that could be where the symptom, urination frequency and urgency, and there could be pelvic floor restrictions, but then we have to look up and down to make sure. I mean, we give almost every patient a pinky ball to roll their feet on because the bottom of the feet and the pelvic floor are super connected as well. So when you're releasing that plantar fascia, it is helping relax everything upstream as well.
That I had a PT that I befriended in New York, and she said the same thing about 25 years ago. She said people do not understand. She had gone to like a seminar for a weekend. She said it was so profound. It makes so much sense. You have
Hmm.
to look at how your feet are landing.
Yeah.
How you're gripping the ground or how you're moving.
Yeah.
And I think about that a lot, because sometimes if my feet are tight, I'll go, my neck is weird, or
Mm.
I'm feeling my shoulders acting up. And I have a rolling pin, and I actually put my socks on and I use the rolling pin and I roll over my foot. And it's amazing. Suddenly things start to release.
Yeah. 100%. So we're never just in the pelvis, even though, we are pelvic health physical therapists. We're first orthopedic
You're
physical therapist.
holistic.
Yeah.
You look at the whole person, and I think that's the beauty of what you do. You have to, you're a detective.
Hmm.
And I think those challenges are really quite beautiful. Um, Let me think of some. Yeah, I mean, please, like, what are things that women might be symptoms that they may not think are symptoms of some pelvic or abdominal issues going on?
So I always tell people norms, 5 to 7 times a day is your urination frequency norm.
Hmm.
And so if someone says, "Oh, I think that's about what I'm doing," we always have them on a bladder diary. There's plenty of apps now. iFlow is one that we like, and they'll come back and say, "I pee 15 times a day, so
Wow.
every hour or every 45 minutes." So that's a big one people don't realize. So 5 to 7 times a day. Under the age of 65, you should not be urinating at night. Um, and most people do. And that could be a symptom of pelvic floor things. Abdominal trigger points can create that little bit of leaking that occurs. Some women, when they stand up from the toilet, they'll have a little urine leakage.
Mm.
That could be from abdominal trigger points in the bulbospongiosis, which is a small pelvic floor muscle. Um,
So I have a question.
Mhm.
Would you internally, you're doing internal release?
Internal release, yes.
Okay.
Yep. And finding if there's any trigger points or restrictions. And then you're talking about you were rolling to help with your
Hmm.
feet, and people foam roll, they Theragun, all those things. We supply women with a pelvic wand, which is a curved
Oh, wow.
silicone internal release device so that they
Oh,
can guide
wow.
some of their treatment. And there's 4 different types of wands. Some have a vibrating component that helps with really hypertonic pelvic floors as well as any nerve damage, and then re-education, and then there's a heating and cooling wand. So there's different types, but this allows women, I call it foam rolling your pelvic floor, so that they can, if we find a spot that we always know is contributing to a symptom, then they can be working on that outside of having to come in for treatment.
That's great. Yeah, I have a lot of times if I see women that are urinating a lot, I look at electrolytes.
Mm-hmm.
But two, I mean, this is really important to know. If you're constantly going, then
Mm-hmm.
there's some,
Or
pelvic
feeling
floor.
that you constantly need to go. That's different than
Yes, the urge.
frequency, that urge. I mean, people have terrible urgency. I have so
Hmm.
many women who come and they say, I can hold it my whole drive home, but the moment I, click my garage or unlock my door, I just completely leak. And we call that urge incontinence, which is very different than stress incontinence, which is stress incontinence is when I cough, laugh, or sneeze or jump
Hmm.
and urine comes out. But urge incontinence can be the most frustrating because you have the ability to hold it until that very last trigger that occurs. And so much of that is just retraining. But if women didn't, or don't know about that, then they could deal with that forever. I mean, we have what I love so much about our practice is it comes full circle a lot. So we'll have a woman come who was told to for a postpartum issue, but then we see their mom because they told their mom everything they learned, and their mom's been telling them for 20 something years that they've had that. And then we'll see their aunt and then their sister, because it really just takes one person hearing, like, did you know you're not supposed to feel pelvic heaviness? Did you know you're not supposed to leak gas when you stand up? All
Mm.
of those things, and then we'll see the whole family.
Well, if you think about it, we work out at the gym and we
Mm-hmm.
do things to strengthen our core, to have better posture and um, just to be strong.
Mm-hmm.
And we work our muscles all the time. We don't think about anything about the pelvic floor muscles.
Mm-hmm.
How would you know how to engage them unless somebody really showed you what to do?
Yeah.
And do you feel that we're seeing more and more pelvic floor health issues
I don't
than
know if
maybe
it's
10 years ago, or is there more of an
I think
awareness?
there's just more an awareness. Now maybe C-section rates
I was
have
just
gone
going to say
up.
C-sections.
So I
Yeah.
would say that is, we just got someone on the schedule yesterday when she was calling and talking to Mary Kathleen. She was like, oh, I don't have pelvic floor issues because I had C-sections, but now I have core issues. And MK is so great about saying, you know, um, that is a misconception that,
Mhm.
the uterus where the C-section surgical birth happened and the pelvic floor are two and the same, right? So,
Right.
we always will also look at the pelvic floor with surgical births. But in terms of it actually increasing, I just think it's the awareness. It's kind of like
Yeah.
when you see pelvic PT places everywhere, you're like, gosh, if they're everywhere, do I need to see a pelvic PT?
Right.
Um, and then social media has just blown it up. The Vagina Whisperer, who is famous for her social media, she did a TED Talk probably in 2018. And that is when I definitely saw my practice grow just from the awareness that she brought to social media. And then people were like, oh, well, she's in New Orleans. Where can I go find one of these in
Mhm.
Atlanta?
That might be the group that my
Mhm.
sister-in-law sing,
Oh,
by the
nice.
way. Yeah. Um, so here's another area, and I would love for you to talk about it. Women have hysterectomies and nothing feels the same. They will have a lot of bloat after and everything. I mean, can we talk about hysterectomies and what actually happens internally and why getting, pelvic therapy, addressing this is important?
Well, I think the biggest thing with that is
You're losing
probably the retraining and the scar tissue, and then what
you're
happens
losing an organ.
during
I
that.
mean,
Yeah. And a lot of times they are leaving the ovaries,
yeah,
depending. So, women will think, oh, well, nothing large is happening, but your abdominal fascia is compensating somewhere. Your core is needing to be retrained. Even if it
yes,
was a
the core.
laparoscopic surgery, there's still scar tissue. And then any type of event like that, there's going to be something that's going to try to protect from that region. So we see a ton of post hysterectomies, and then just retraining. And unfortunately, sometimes from that tissue not being there, the pelvic floor is used to feeling. I always talk about you typically have three people on your hammock. Now there's a person not on your hammock. So sometimes it will do this. And then just educating women too on the hormonal changes and the dryness and things like that can occur. So yeah, we see a ton of post hysterectomy clients.
Well, in Chinese medicine, we talk about the uterus as being the small heart. So when you're energetically removing that, it's like things just also energetically shift.
Mhm.
And how do
Mhm.
you fill that space with something else, or how do you
Mhm.
balance that? So I think it's a big deal. And that my mom had 10 kids. My mother had a hysterectomy after my youngest sister. She also contracted hepatitis C at that time because of the blood transfusion.
Wow.
And that's what when she finally passed away in her late 80s, that's what she had. But yeah, I mean, she had a prolapse of the uterus, of the rectum, and they did a hysterectomy at that time. So yeah, and I don't know, it's so interesting because we never talk about it. I mean, I never spoke with her about it, how that felt, what
Mhm.
issues she had. But I
Mhm.
think she had some incontinence, which is quite common. So, I'm going to state the obvious. I think any woman that's had a hysterectomy would so benefit right afterwards. Part
Oh,
of their recovery is seeing someone like you. And are these
oh,
recommendations being made? Am I stating the obvious
I
here or
mean,
not?
from some people, yes, for 100%. I mean, even after getting your appendix removed. I mean, anytime there's anything that
Wow, that's interesting.
because
Okay.
there's fascia involved, and when you have myofascial restrictions, less blood flow. So we do a lot of silicone cupping to get blood flow in the abdomen around surgical sites. Just teaching women too, even though most of these surgeries are laparoscopic, you still have small surgical sites, and teaching
Hmm.
women how to just manipulate that tissue and the scar tissue to
Hmm.
get it working again. And with that, I mean, we have plastic surgeons all over Atlanta who refer for post tummy tucks, breast reductions, um, any type of abdominal surgery that creates a lot of scar tissue because that can cause other things, to
Yeah.
overcompensate as well. So, yeah, post surgical is becoming definitely recommended for any type of rehab, just like it would be if you had an ACL repair or shoulder meniscus, or anything.
So I just want to touch back on what you said. So can you share a story with someone that's about someone that had an appendectomy and you realized that from the appendectomy that they were having issues, there were scar issues or,
So more we've had because we work a lot with young women, which is typically the age that would occur. We've been
mm,
seeing somebody and they then tell us, "Oh, I ended up having to have my appendix removed." And then now we're working on that because we're noticing some of their pelvic floor symptoms increase again after we
oh
had them
wow.
under control. So we haven't yet had a referral just because someone had their appendix removed. More we were seeing these women throughout their care and then, oh, this happened over the weekend and they're like, should I not come? And we're like, no, we need to get this going
Hmm.
because those restrictions can cause some of the things that we've resolved to creep on back. So that's typically more what we see. But even a pelvic PT here in Atlanta ended up having to have her appendix removed. And she talked a lot about that on social media. Like, oh my gosh, guys, after seeing what occurred with me, I'm like, this needs to be a protocol now because
Hmm.
she was having some abdominal issues, some urination frequency and urgency, and that was most likely coming from
Wow.
the scar tissue.
Okay. I had someone I worked with years back, and she had she did an IVF treatment. She was actually she did an egg retrieval, and
Mm,
she said after that she never felt the same. She had terrible pelvic pain, and um, I referred her out to see a pelvic floor therapist,
great. Yep.
but she said it happened right after the egg retrieval.
Wow.
So,
Wow.
um, let me see what other cool questions I have here. Uh, and is there anything? I think this is such a great conversation to have because um, I don't think people really think about this.
It's getting more and more and more discussed, even on like actors and actresses have come out and talked about.
Mhm.
I mean, I'm so terrible with names of actresses,
So
but
am I.
in
That pretty one with the blonde hair?
yeah, for
That's
sure.
really funny. Yes, right.
But so many have come out and said, I saw a pelvic PT for my endometriosis, for
Hmm.
my, during my fertility treatment,
Right.
postpartum. Oh, I had pelvic pain, vaginismus. I mean, there's now been,
Mhm.
this week, there was on PBS a whole endometriosis special. I mean, that was crazy because endometriosis is huge and we never see it in the media. So that just happened. There was a movie all about vaginismus and in TV shows. I don't know if you watched the Netflix Sex Education. It was super cute. Took place
No.
in a high school, very fiction, but inside of the sex education show, the word vaginismus, vulvodynia, dyspareunia,
Yeah.
pelvic floor PT was all talked about. And teenagers watched that show. So then that brought it to the attention of a lot of individuals as well. So I think that it used to be more taboo, but now I'm hearing there's moms clubs all over Atlanta, and one of them is called Circle Moms, and it's located in Brookhaven. And
Hmm.
we go talk to that group every time they have a new cohort, and it's so incredible. They'll say like, "I had no idea about this," and then the other side of it is like, "Girl, that's what my whole Instagram feed is." So it just depends on what people around them have discovered.
Yeah, I had watched somebody's Instagram, I think, or it had been FaceTime, and I love that she did this. She said after she had her child, the docs are like, "Oh, don't worry, you can have sex in 6 weeks." She was like, "I can't have sex in 6 weeks."
Mhm.
And then 2 months, and then 3 months, and she was like, "It's too painful."
Mhm.
And her husband was going, mm-hmm. He was
Mhm.
next to her.
Mhm.
And then she did pelvic floor therapy, and she said it changed her life.
Yeah.
And that's really what made me, because I was wanting to explore this more and see if I could find someone like you. And I went, oh my God. But I was so delighted that she shared her story, because she said this is an issue for women. She said it was 6 months and I was still having problems.
Yeah, I know. It's so that pain with sex postpartum is so, so, so common, regardless if you had any tearing, episiotomy, surgical birth, with epidural, without epidural. It's typically, I tell women, similar to getting in a car accident with a little bit of whiplash, everything kind of goes into this state. Very typical, which women usually say, well, I thought the opposite was going to happen. I thought I was going to be so relaxed, and they use the term loose, but actually what ends up happening is all the muscles go into this restricted state, which then does create weakness, because a muscle that is too tight is essentially weak and not under
Oh, that's
control.
interesting.
Hmm.
Could
So
you explain that?
we teach. I mean, I kind of think about it in the sense of, if my trap is always like this, then my trap can't do the job that it's supposed to do, which is, lift and do things like
Right.
that. So if my pelvic floor is like that too, it can't do its jobs correctly, like relax
Mm.
to use the bathroom and then engage when I'm about to cough, laugh, or sneeze. Those natural automatic things that are supposed to happen aren't going to happen correctly. Um, so you may be weak, but weak in a different way than your brain thought. So to approach the pain with sex, we're doing so much myofascial release, getting rid of scar tissue internally, reteaching that pelvic floor how to open with diaphragmatic breathing, posture, pressure management, um, and giving them tools such as dilators if they need that, the pelvic wand if they need that. Sometimes it's lack of estrogen to the tissue, so retraining with
Hmm.
getting on board with a provider who will supply topical estrogen. So it just it just depends. It's multifactorial, but pelvic PT helps so much.
Well, in the beginning of this talk, this conversation, you were talking about other cultures really are looking at pelvic floor
Mhm.
issues. And I wish I could remember this practitioner from New York. She's so lovely. And I think she wasn't from the Philippines. She might have been, but they had this practice that after a woman would have a child, they would do these herbal wraps
Mm.
and these herbal treatments. And that would really help with prolapse and inflammation and all that. And I can't remember, and I'm going to have to look into it and I'll let you know. But she said women would recover beautifully after doing this.
Oh, I've heard that. I've had so many women give birth in another country and then also give birth here. And two that I just will never forget. One was from Korea. And when she was
Mm,
in Korea, she went to a postpartum, like, seems like a luxury hotel afterwards for
right.
40 days where they had chefs preparing nutrient dense food like bone broth and seaweed and all this stuff.
Hmm.
And they had a physiotherapist, which is what they call physical therapists there, come do myo-abdominal work and pelvic retraining. They would have someone help with breastfeeding, someone help fold laundry, teach how to get your baby to sleep. Like, and then she said when she was here, she saw her provider once postpartum who was just like, "You can have sex, you're good." And then the other one was from France, and she was emotional about it because she said in France you just see your midwife or your doctor so often postpartum. You do these checks at like 1 week, 2 week, 4 week, 6 week, 8 week. And here she was like, no one called me. They just
Yeah.
sent you home. No one did anything. She was like, who would have give birth here? But we don't know. Like that's just what.
Well, maybe that's part of the postpartum depression picture because women are not getting the
The hell.
support that they need.
I mean, I thought it was crazy. We took Oliver to the pediatrician. That's my son's name.
Mhm.
We probably took him when he was born like 20 times in his first like 6 weeks of life. They have you go all the time. But
Mm.
I, who had a fourth degree tear,
Mm.
vacuum, all the stuff, I saw my midwife one time. And it's just crazy that your child, after you give birth, it's all about your child. It's not about your health at all, and they're not even giving recommendations, based on birth. And if you have a fourth degree tear, you're told at 6 weeks that you can have sex. If you had no tear, you're told at 6 weeks.
Oh my
So
God.
it's not based.
Well, I just feel, I mean, we could do a whole, sometimes I just feel women and women's health and women's position, we're in the back seat of the car.
Yeah,
We're
yeah,
sitting in the back seat, sometimes we're in the trunk. We're not made a priority.
yeah.
And, not just in the workforce, but as moms, as women having children, we have to bring, I don't even know where to put it. You just gave birth to a child. You brought a new human being into this world. This is a sacred time for women to heal. And Asia and China, I mean, there's all these healing soups. The relatives come in, the women come in, and they support. I mean, I know that when my mom had us, we were born in the 50s and 60s, and our relatives, our aunts would come over, and there was that support. But yeah, I see it. I think it's crazy. Women have to, and for a variety of reasons, go back to work so quickly. It's very hard.
I know, I know.
So what else would you like to say? What words of encouragement? What would you like women to know about their beautiful pelvis, about their first chakra, about their goddess? I'm telling you, this is a sacred, lovely area of a woman's body to celebrate.
I would just say that advocating for yourself, if you think that something is not right, keep going because one provider may say all is good, and then the next
Hmm.
may say the same thing, but continue doing your own research because a lot of these things that are common doesn't mean that they're normal. So even though everyone
Right.
says urinary leakage after you have a baby is common, or pain with sex is common, or you're just going to pee like that all the time, or have pressure, your core is never going to feel the same. All these things, yes, we talk about them a lot, but that doesn't mean they're normal. They can be helped. I have so many women who are like, it took 4 months to find someone that I thought was going to help me, like you're helping me. So just keep advocating for yourself, and And also just learning the norms. I think learning what bowel and bladder norms are, and what how sex should feel, and in general, all the women's health norms. And then that way you could find out if there could be more help for you.
Well, my love, I want to thank you so much for being here today. I am going to include all your contact information so women in Atlanta can reach out to you. You are such a gift to the community.
Thank
I
you.
know, I love your t-shirt. It says
Yeah,
it all.
right. Yep.
There you go.
You hear this? So we have two t-shirts, and one of is this with the pelvis, and then we also have one that has two tigers and it says power to the pelvis. And it's so funny when people are like, "Oh, your shirt's so funny." And I'm like, "Funny? This is the word pelvis is not I don't know. It's pelvis is a bone. Just like my, humerus or my femur, or but when they see the word pelvis, they think, they almost chuckle. So I'm hoping that, that gets better with it being
Yeah.
normal. It's just the
Well, we need
musculoskeletal.
to talk about these things a lot
Mhm.
more. Excuse me. And I think women need to voice, and I've seen this, that women think it's normal. Well, I'm having some pain with intercourse. You're not supposed to have any pain.
Yeah. Yeah.
And so thank you so much for being here. I'm sure I will have you back. And I want to thank all my listeners today for listening in. And if you would like to find out more information about me, I will include my contact information, as I always do, in the show notes. I want to wish everyone a sweet, lovely day. Take good care of yourself. You are a sacred, beautiful goddess, and you deserve the very best in the world. And until the next time on the Hormone Lifestyle Zone, I send you a lot of love and big hugs. Be well.